Hi guys, welcome to my first ever YouTube video, and the topic for my genetic disorder is polycystic kidney disease, and this is known as PKD. This disease is like the most common cause of kidney failure in adults and children, and it is characterized by cystic dilation of the renal tubules. This disease caught my attention because my uncle, I have a dear uncle, and also a friend that I grew up with lose their life some years ago through kidney failure. So I really wanted my topic to be this. And at this stage of cystic dilation of the renal tubules, the kidney or the both kidneys can be affected and they become enlarged and often reach its pinnacle, which is like the end stage renal disease. And at this stage, the kidney loses its ability to remove waste and also balance fluids in the body. PKD can be inherited as either an autosomal dominant trait or autosomal recessive trait, but I'm going to be focusing more on the autosomal dominant trait, also known as ADPKD. This disease is caused by mutations of PKD protein polycystin 1 and polycystin 2, also known as PKD 1 and 2. Some studies have been done and DNA samples collected from patients, and it was discovered that this disease cannot be detected in children. So most times it's the people with PKD get to a certain age before they can be diagnosed or go for a test. And DNA samples were collected from patients, and it was discovered that mutations located towards the 5 end of the PKD are associated with earlier onset of this end-stage renal disease, and is risky because at this stage the intracranial aneurysm is ruptured, which is like the blood vessels in the brain. A doctor at University of Alabama, Dr. Yoda, conducted and reviewed the structure and function of the primary cilia and discovered that the loss of polycystin 1 and 2 in the cilia is like causes like a disrupt in calcium dependent signaling pathway that leads to also a dysregulated increase in fluid secretion. So the body is like interconnected, and these two animals were also used as a case study, and the formation of the cystic disease suggests that the balance between the signaling pathway may cause an abnormality. In most families, the mutation responsible for ADPKD is located on the short arm of the chromosome 16, close to the gene coding for the alpha chain of hemoglobin. The locus on chromosome 16 involved in ADPKD is known as PKD1. 10 patients were also examined by microdissection, and it was found that urinary tract infection and hypertension may occur in the early stage of this disease, and their diagnosis were conducted through the collection of kidney fragments, loops, and tubules, and it was tested, and it was discovered and recorded that 4% of patients with autosomal dominant polycystic kidney disease may not have PKD1 mutation. So this means that the extensive information about a patient pedigree is always required in order to determine if this disease is together with the chromosome 16 markers, and that the markers can be used in also the diagnosis of this PKD. A newly developed inhibitor of tyrosine kinase activity would also reduce the renal and biliary abnormalities in ARPKD, which is like the autosomal recessive PKD. So when it's still in the autosomal recessive, so the inhibitor can help in the treatment before it gets to like a full-blown dominant PKD. Oh my god, I can't believe I finished this. Thank you so much for watching. I'm glad. I tried so many times. God knows I tried like 1,000 times before I could get to this point. I know my voice has changed because